just gonna have to hold this. Too short. Hi, everyone. Thanks so much, Shirley, for the invitation. Thanks for being here. I give talks on a lot of, thank you, a lot of different topics. And this is the topic that parents always tell me they worry about the most and is when they go to sleep at night, what's on their mind. I'm a president of the National Council on Severe Autism. We're a relatively young advocacy and education nonprofit that really tries to create a louder voice for the families and individuals who are affected by more severe forms of autism. Yep, there it goes. So I'm not one to prettify autism. I'm not one to normalize autism. I'm not one to treat autism just as a mere diversity. I have a pretty serious view of autism, and I see us facing an unprecedented national crisis with the growing rates of autism. The earlier generation of adults with intellectual and developmental disabilities really had very few people with autism in it. Those cases were predominantly mental disability associated with Down syndrome, CP, epilepsy, rare genetic syndromes, perinatal hypoxia, or other similar traumas, and early life brain infection. These people generally had shorter lifespans, often not outliving their parents. But with the autism explosion, and in addition, and thankfully for better health care for adults with intellectual and developmental disabilities, we now see more and more and more of our kids will very likely outlive us. And this is a phenomenon for which our system, I want to say, is utterly unprepared. Now, these are data from our California Developmental Services System. This shows the autism cases in the current DDS caseload by birth year, from 1947 birth year to 29, oh no, I think it's almost 29, yeah, 2019. And you can see that we have very, 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 very few adults with autism who are really above the age of 40. The vast majority of California's autism population is under the age of 40, and even the vaster population is under the age of 30, and even bigger is under the age of 20. So we see coming ahead of us an enormous wave after wave of children who are exiting our school systems and into an adult system that is utterly unprepared for them. So what we can expect down the line based on our data is an explosion in what I call adult orphans. And these are adults with autism who have lost their parents, either because their parents have become incapacitated or because their parents have passed away. So this is a back of the envelope projection based on DDS data that makes a couple of basic assumptions. I don't have to go into the details about the assumptions. Again, this is back of the envelope. But it gives you an idea about the population of these adult orphans with autism. It's probably about 8,000 today, might be a little lower than that actually. But then we can see it tripling and then growing 9-fold and growing 20-fold by the time we're in 2055. This is just a meme that someone created at NCSA using one of my quotes. If autism has always been around in these numbers, surely we would see the legacy of programs and housing services all around us, but we don't. We must now invent a very complex and costly future for our loved ones, because autism parents like me, we will not live forever. So parents, as much as sometimes people like to criticize us for whatever reason, we are most certainly the heroes of the autism story. In one package, mom and or dad perform countless jobs to support their children and their adults. So when we lose parents, look at what we lose. We lose, and this is only a short list. We can think of a dozen other roles that we play. We're the housing provider, the program manager, their guardian, They're financial managers, they're benefit manager, they're advocate. We protect them from abuse and neglect. Where they're cooks, where they're drivers, where they're hygiene managers, which is not a small thing. Where they're housekeepers, they're launderers, they're medical and dental supervisors. We manage their medications. We manage all the trips to the pharmacies. Where they're recreation provider, we take them to Disneyland. We take them to the beach. In the case of my daughter, I take her skiing. Where they're interpreters, where they're iPad fixers, which has actually consumed a huge amount of my life. Um, where they're handymen, and we are their source of love and nurturing, or at least their primary source of love and nurturing. Replacing all of these roles is no small task when we have the adult orphans. So, what we see in the real world is that often one autism parent has to be replaced with 5 or more professionals to get that same job done. We need conservators, we need trustees if you have a special needs trust or another kind of trust, case managers, and that can be a private case manager that you hire, and or the regional center case managers, which tend to be pretty minimal. Agency supervisors, the direct support staff, and the specialized contractors. So if you're my son and you are in the business of destroying property on a pretty continuous basis, those specialized contractors are pretty important. And then, of course, there are the social workers, and we see social workers both for IHSS, CalFresh, Regional Center. There's a bunch that interact with our population. Never underestimate the importance of an autism parent, people. So there's a myth, I think, that, well, it's okay because, when the parents go, the siblings will step in. In my experience, this is mostly untrue. The siblings love their autistic siblings very much, and they usually don't want the 24/7 responsibility for them. And the parents also don't want to impose that responsibility on their other children. And I believe everybody's person-centered life matters, not just the person with ASD. We also have to think about everybody else around that person with ASD, including siblings. So siblings on the whole, again, this is my experience. You guys might have a different observation. They seem more interested in playing limited roles, such as acting as a conservator or co-conservator, acting as a trustee or co-trustee. And if you want to see an example of one sibling, a sibling she's a twin of a brother with severe autism, please look up what Carla wrote for us in 2 blog posts on National Council of Severe Autism website. I had never read anything so raw, so honest from an autism sibling about her fears about the future. I cannot live like my parents, confined to their home and with someone who constantly beats them down and requires their attention. Will I be able to work? And if so, only to come home to extreme caretaking in my off time. Autism is insanely expensive. I will not likely have the financial resources we would both need over our lifetimes. What if I had a child like my brother? I am certain I could not endure raising another child with autism on top of the fears I have about being Tim's guardian as an adult, et cetera, et cetera. Will I be able to find a life partner who will accept Tim into his life, et cetera? And these are very real concerns, even if maybe your children haven't voiced them to you. So we should be really honest about the challenges that lie ahead. The costs associated with autism as an adult can be absolutely astronomical. And we have regional center people here who could probably tell you more. But what I see is those costs, at least in California, on the very low end, tend to be about $50,000 a year, and that's really minimal. That's barely getting services, to over $1 million per year per ASD adult. And I've met some of these $1 million a year kids. They tend to be extremely severe and need, 3 or 4 people on them at a time. And one of the problems in our system, aside from really not having enough money in the long term, is that it largely excludes those with challenging behaviors, although, of course, there are exceptions. Vendors and staff tend to reject them because why take on a challenge that costs them more than they're getting in reimbursement? And there's no beds really available for those in severe crisis in the residential realm. Regional centers have a few options for them: the enhanced behavioral homes, behavioral SLS, self-determination. But often, we find that doesn't solve all the problems. But at least in California, we're better than other states. But we find our system is already past the breaking point and it's nothing compared to what's coming down the line. So we really do need a system reset to match our new realities. So, how do we prepare? Well, basically, there's two answers to that question. We need to do we need to prepare privately, right? And that's what our next speaker will talk about. And we need to also advocate for systems change and take public action. So through NCSA, through organizations like Autism Society San Diego and others, we can work together to create lasting long-term change. Now, it's not my role to detail all the things you should be thinking about and planning for your future. But maximizing public benefits. This is all the stuff that you'll learn about. Thinking about successor conservators when you're no longer able to serve. Setting up your special needs trust. And how do you fund your special needs trust? Do you use in life insurance or something else? Setting up an ABLE account, but those are pretty limited, up to $100,000, which frankly doesn't go far for our kids, I'm sorry to say. Finding case managers, setting up a family committee, setting up what I call perma parents, which would be like a committee structure for after you're gone. Hiring an organization like National Care Advisors, Good Shepherd Fund, et cetera, that can be your case manager as you grow more older and infirm. A letter of intent, and all of those key pieces of information. This stuff is really important. I helped take over the care for a young man who lost his single mother, and she had none of this stuff organized. And I will tell you, it was really a pain. It took me days and days of work to help through this transition after she passed, unfortunately. And then, of course, there's the staying healthy. How do we reduce stress? How do we lengthen our lives? How do we stay as involved as long as we possibly can? I'm no, doctor. I'm not here to give health advice, but that is, of course, on everybody's mind. How do I not get sick? How do I not get cancer? How do I not get Parkinson's? How do I not get dementia? Because there's so much at stake for us. And then public actions. And so that's where people like NCSA come in. How do we turbocharge our policies to ensure proper lifespan care? How do we convince everybody in the Senate and in the House and on the state level that this is a real public health crisis and that we need to make sure we have a bedrock solid foundation for our grown children? We also need to think much deeper about how to make our system more efficient, how to take costs out of the system so more of the money goes to our kids' care and less of it goes into bureaucracy. We really need to think about the whole ASD adult population. Unfortunately, a lot of disability rights activism now focuses only on people who are higher functioning. We need probably new kinds of ways to save money, new kinds of ways to save on taxes. Maybe we should have a new kind of ABLE account just for those who are really severely affected instead of just being thrown into the pot with everybody else with a disability. We have to think more and more about intensifying these programs for our kids. How do we get more flexibility into our really insanely crazy Medicaid system so that there's more options, more choice? How do we get HUD? When I say HUD, that's Housing and Urban Development. They are the major subsidizer of housing for people who are low income and are disabled. But we aren't seeing a lot of that HUD money come into our population, I'll tell you that. So how do we get our kids prioritized for those HUD subsidies? How do we get more caregivers support, more training? I mean, listen, I can go on and on and on. There's so many things that we have to do, but it gives you a sense of what the struggles we have ahead. And I know, talking to parents, sometimes they're like, I only have time to take care of my own kid. I don't have time to take any public actions. And I understand that, but you can sign letters, you can make a call. There are things that you can do. It doesn't have to be a full-time job. And so finally, I want to end just talking. I referred to a young man who I helped care for now that his single mother had passed away. He is one of the loves of my life. I adore him. And I am bringing him to Disneyland this month. He's so excited. And he's a verbal young man with autism, but he's the first time I've really seen intensely what it's like when you lose your parents. And I want to say it's very, even though he's in a great group home, and he is surrounded by people who love him, it is what I call the 80-20 problem. So the 80-20 problem is this: 80% of the battle is being safe and stable. And 20% is that everything else in life that is wonderful and happy and makes life worth living. The 80% with Ryan is achievable. He's safe and stable. Thank God, right? Because I know a lot of people who don't get good services through the regional center. He is. The problem is that 20% that his mother used to provide. The love, right? The nurturing, the constant, contacts, the constant doing this and that errand for him, the constant taking him to this party or that party, the taking him to Disneyland, all that other stuff. I mean, I help try to fill some of that 20%, but obviously I can do nothing remotely like his mom. And it's been sobering to see that. So I will end my remarks there and turn it over to the next speaker.
Thank you so much, Jill. And now I'd like to introduce Wendy Smith, who works at the Home of the Guiding Hands. Thank you, Wendy.
Thank you, Shirley. Thank you, Jill. I really appreciate. They're going to get my PowerPoint up in a moment. I will confess that I took my title directly from Jill's suggestion once it was shared with me from Shirley, but this is certainly not a new concept for me. In my role at Home of Guiding Hands, I'm the life planning specialist, which means I spend my time talking to families about what do you really want your child's life to look like in 20 to 25 years? And what action can you take today to start making that reality? And it's not an easy concept. And it's different for every single unique individual. It's different for every single unique family. And the challenge is helping them see what their options are. So when we talk about the concept of autism parents can never die, why do we feel that way? Every parent theoretically wants their children to have grandchildren, and they're gonna live on through that extended lifetime children. So they're not necessarily worried about their mortality. They're not excited about it, but they're not necessarily worried about it. For parents of children with autism, there's a whole different dynamic because we understand we have all the knowledge. We are the ones that get all the questions. We are also the ones that have all the responsibility. That giant list of things and roles that Jill shared, that's our daily reality. And nobody is jumping in and saying, "Ooh, just sit down and take a break. We'll do that for you." It's on us every day. And we have also, I think by a quick show of hands, we have all seen what happens when we are not consulted. And it's not a pretty sight. So we are very scared and worried about the idea of the time that we are not going to be available. In addition to all of that actual care, parents also spend a lot of their time not just providing the care, but interfacing with all of the other support systems. So we're the ones that explain patterns. How often does this happen? What circumstances does it come under? What kinds of triggers make this occur? What's the language that we use to navigate that? How do we prepare them? What do we say in advance? How much time do we give them? Do we talk about it a month in advance because they really have to process? Or we don't say it until we're buckling the seatbelt in the car because otherwise they will talk about it 24/7 for that entire month. We are translating communication. My own son is verbal to a degree. When he was young, he would assign his own words to things. We went through what is in retrospect kind of a funny dynamic where the school called me and they're like, "What's wrong with his feet?" And I said, "I don't know. There's nothing wrong with his feet." They're like, "He keeps yelling about feet." And we take off his shoes and he's kicking us and he's saying, "No, feet." 4 days later, we come to realize that the screensaver on the computer in the classroom had a pair of feet walking across it. He wanted to play on the computer. He was using different language. So there was a translation that was required. And, I get maybe 75% of what he's saying on a regular basis if it's something that he always says. When he says something new, I have no hope. Recently, we tried to go to the zoo and I always ask him what animals he wants to see. And he said something that sounded like, "Ugh." I was like, honey, I didn't quite get that. Say that again. He goes, "Roar." And I was like, one more time. "Roar." I was like, what is it next to? And he said, "Roar," and monkey. I was like, oh, gorilla. He can't pronounce G, R, or L. I had no hope of figuring out that he meant gorilla. So translation is a constant effort on our part. Selecting programs, we are the ones who decide, is this an acceptable service? And often we do that without a lot of context. I don't think I'm alone in starting a service and then a couple months in realizing this is not going to work for us. And we had to make a change. Training the staff, even if it's just a respite worker that's coming into your home in that familiar environment where your child ideally is going to be the most comfortable they're going to be in any situation, you still have to tell that staff what they should and should not do, when they should and should not provide care, what is bedtime. Because I'm sorry, my child has a disability. He is not dumb. Mom is out of the house. I'm going to see what I can get away with. So you have to set that context and do the training. We're also constantly running experiments because we know there is something more. There are always things that we're like, this could be better. This could be less challenging. What can we do about that? And we're looking for the tiny nugget of anything that works. Even if it's something as simple as buying us 30 seconds between the demand and the meltdown. Sometimes that 30 seconds is gold because we have a chance to say one more thing that averts the meltdown. So we're looking for anything that's going to buy us that little bit of time. Whatever the dynamic is, we're always looking for what else might work. We're constantly reviewing forms. I have to admit, I am not always the best at this. It's been a while since I sat down and read every word of my son's IPP from Regional Center, because I know a lot of it gets recycled. And I read it the first time in a lot of detail, and then I gave them the 3-page list of things that were wrong, and we corrected a lot of that. But we're constantly reviewing forms. And on top of all of that, we are the ones who are fighting for inclusion and rights and dignity. Those are not things that are given to our children. We have to set expectations. We have to demand services. We have to advocate constantly for equal treatment. And when we are doing all of this, we have to recognize, regardless of any training that anyone else has had, we are the subject matter experts when it comes to our children. They can have all the book learning in the world. They can have read all of the case studies. They can have authored papers. They have not been in my house at 3:00 in the morning. They don't know what I know about my child. So when we are interacting with all of the services, when we're talking to professionals, we have the answers. They give us questions and we can talk about our history. We can talk about developmental milestones and when they happened and where the delays were. We can talk about challenging behaviors, what they're designed to do, what that means to the individual, how significant, what's the scope of it? Can it stay pretty low key? Does it get like extreme, like you're calling 911 and running to hide in the bathroom so you don't get killed before the police get there? We can talk about all of that. We can talk about treatment history. We can talk about health concerns and how they impact all of these other categories. But answering questions is not the same as sharing information. And that's the reality when it comes to really making sure that we are sharing everything that needs to be shared. We can't rely on people to ask questions because answering questions is passive sharing versus active sharing. When we answer questions, we are waiting for an inquiry. We're letting someone else decide the information that they need, and they generate the question. So that puts them in charge of deciding what's relevant to the situation or the service or the interaction. We're not in charge of that. They get to decide what information they feel that they need. But if they don't have any questions, like they've read the report, they have our child's IPP, we've been accepted for services, and they don't have any questions, thank you so much for coming in, and we can go ahead and leave. I don't walk out of that meeting feeling like I'm not totally confident that they actually have all the information they need. Just because they didn't ask me questions doesn't mean that there's not more information that would be helpful and relevant to them. So in our minds, we know that not having questions is absolutely not the same as a complete understanding of our children's needs, abilities, or challenges. And we have to take a more active role in sharing information to make sure that what we know is relevant is part of the included material. But that can be information overload because we have so much information in our minds. We have all of the details about daily routines and habits and preferences and communications and all of the pieces that we just routinely use and don't even know that we're tapping into until we start trying to figure out, like, what do I really need to share? And then we have to start filtering. And that's where we run into problems, because we have to decide, what do we want to share? How can we transfer it all? Do they really need all of the details, or do I just need to hit the highlights? And how high do the highlights have to be? Where's my cutoff point? What is really most relevant to this particular service, to this particular situation, to this dynamic, to this provider? All of the above. What is no longer applicable, but has to be shared because it's foundational to understanding what still is. And this is where we look at our children as lifelong learners. They are constantly evolving. My son, he's 32, is not at all the child that he was when he was 5. But the things that happened when he was 5 and was nonverbal and had no outlet for communication and could only express his challenge through his actions, that became a really typical pattern for him. And in the face of any challenge or frustration, it is his go-to action. So even though it might not happen for months at a time, it's important information for people to share and understand that if he's challenged, if he's frustrated, if he can't express his need correctly and you're not understanding him and asking questions to support him to figure out what he really needs, buckle up, because it's going to get ugly, because he just wants to let you know, I'm not happy. And he has figured out a long time ago that if I break a window, somebody knows that I'm upset. Okay, so what do I have that I can throw? And it's quick. It doesn't take long. It doesn't happen every day, but it's still very relevant information that needs to be shared. And then once we've kind of figured out, like, where is the line? What are we going to share? What needs to be shared? How do we organize it? What makes sense? And this is the question that really frustrates so many parents. What if we miss something important? What if I just wasn't thinking about it on that day when I was filling out that questionnaire for that one service? And now it's never going to be part of his history. And 3 years from now, it could be the missing piece that would explain so much about why he is not thriving in a specific program or service. It can be extremely overwhelming. So, right now, with me, please, let's all just take a deep breath and appreciate we don't have to figure it all out at once. We don't have to have the answers in the next 5 minutes. Little steps forward will still take you toward that desired future and bring greater peace of mind. Every step that we take toward completing one of those forms that Jill referenced, completing one questionnaire to identify whether a service is going to be appropriate or not, one conversation with extended family members to identify how on board are they really about being part of this child's future care picture. I know brother said when he was 8, like, oh yeah, I'm always going to take care of my brother because that's what brothers do. Well, now he's 30. What if he gets married and has a family and his wife is absolutely not on board with this guy who's going to come in and break her windows every other week? That has to be a conversation, but it's a little step. It's not going to be a make or break difference in my child's life in this moment, but it's a necessary step toward a desired future. And regardless of how young or how old your child is, I just want to reassure you, it's never too late or too soon to start life planning. Parents, when they first get the diagnosis, they're completely overwhelmed. It's not too soon to start life planning. Parents that are like, okay, I just lost a spouse because of something related to age and I'm not doing so well myself and I haven't set anything up and now reality is crashing down on me. It's not too late to start planning. Planning is always available to us. So the best and most effective path forward when it comes to life planning starts by clarifying the desired future. We have to find a focus. If we're just like, I want them to be happy. Well, happy is pretty broad. How are we defining happy? What does that look like? What does that sound like? And that might mean a process of elimination, starting with what we know it's not going to be. I don't want him to be struggling to be understood. I don't want him to be taken advantage of financially. I don't want him to be trivialized and minimized and stuck in a corner and not interacted with just because he's being calm and quiet. Those might be my negatives. This is what I don't want. And that can help me narrow in on what I do think is important. But it's critical eventually that we get to the bedrock of what we do want in the future. And I talk about that as identifying the non-negotiables. And that might be a location, it could be a career, it could be a tone to the support. There's a very big difference in my son's world about somebody saying, hi, and somebody saying, hi. The first person, he's going to turn and just like look somewhere else because he just doesn't care. But that second person, he's going to be like, hi, or hello. Maybe he'll give him a fist bump or a high five, but he's going to engage with the second person because tone matters to him. So that might be something that I really emphasize. It could be the structure to the day. How much time do we need for transitions? A lot of people understand in the world of autism, there's no such thing as we stop this and we start that right away. It could be a half-hour process to taper off the preserved and start to set the foundation. And eventually we might get to that new activity, but there's a process to that. It could be the time and space without demands. I talk to a lot of families, and frequently coming home from school, I can't tell you how many parents tell me, oh, we need at least 30 to 45 minutes before we put any demands on. Even something as little as put down your backpack is enough to have that backpack flying because it's demand. And they just survived school where they had nonstop demands for 6 hours and they are capped out. They need a break. That could be a non-negotiable in every service system in the future, but we have to identify it. And it's going to be individual and unique to every person. So while we have big scopes of policies and big procedures and big resources available, we really have to find the focus for how our child needs to access those, how they are going to be applicable. So that comes down to asking the right question. Once we know what we're aiming for, then we have to start moving that direction effective now. We don't want to say, oh, there's going to be this wonderful future, and 10 years from now, I'm going to start asking the right questions. The more we can start in the present, looking at what's necessary to build toward that desired future, the better chance we have of achieving it. We might be told no, and that means that we have to do some of the advocacy. Maybe we have to get involved in some of those public information processes. Maybe we need to share our story more vocally. But we have to start asking questions to start getting the information about where the gaps are. So with that desired future in mind, what services are essential? What's top of the list? What's the first thing that we absolutely have to have? I have this laundry list of things that would be wonderful, but if we don't have number one, the others don't matter. So what is the one most essential service, or the 5 most essential services, or however many you feel are absolutely essential? And how do you define essential? That's another thing to think about. What accommodations might be necessary? We are seeing tremendous service delivery changes and changing laws, changing guidelines. A lot of those are about inclusion, but inclusion often means that there has to be some accommodation. My child can't just necessarily walk in and participate in the same way that everybody else who is participating in that service. They might need to have somebody next to them. They might need to have a model for a little while. They might need to have somebody that is clearly identified to them that they can ask questions for. What do those accommodations look like for my child given their skill set? What skills would the supporters need? They need to be really outgoing. They need to be very patient. They need to be able to speak slowly and softly and quietly in that nurturing tone. I don't know what those skills might be. They're for your child to identify for your child. What kind of contact or interaction do the services offer? And how does that tie in with what my child really needs? And how flexible are those guidelines? We've talked in other areas about qualifiers and kind of the medical model and the diagnosis and how much of an impact that has on what's accessible to individuals. So if there's an ideal program and it provides the right kind of service, but my child doesn't meet the guidelines, is there wiggle room? Can I make the argument? I don't want to necessarily just take the first answer of no. What safeguards does a location provide? That's a big one in our world. My son will take off the drop of a hat. And if there are not safeguards, he could get lost. He could put himself at physical risk. He could be injured. It's a concern. And what are the consequences that are enforced if rules are broken? If my son doesn't necessarily understand a rule, may not agree with a rule, may just completely disregard a rule because he doesn't like it, what are the consequences? Is it going to cost him his program? Or is there something that we can identify that would be an acceptable response to both parties? but I have to know what the consequences are, and I have to know how strictly they're enforced to even have that conversation. So much of the right conversations is about asking the right questions. And we get to set the tone. When we are the ones who are deciding what information to share, we're not just waiting passively for questions to come our way. We get to create the team. We get to select the services and begin to share information. We're not just passing along facts. We are building a picture of a unique, wonderful, caring, fantastic individual who's going to light up lives if they have the opportunity. We're sharing our thoughts, our concerns, and what we put emphasis on. Because remember, we are the subject experts. We know where the emphasis belongs. So we get to share that. We are establishing the criteria that we use when we're making decisions. It's not just I chose this. This is why I made this choice. These are the things that I factored in. These are the things that I took under consideration. And this is how I arrived at the conclusion that I did, that this is a good service for me. I'm not just passing along a fact. I am building a picture and sharing information. And we're identifying those non-negotiables to make sure that there's ongoing and optimal quality of life. That's what I want for my son. I don't just want him to be safe. I want him to be thriving. I want him to be celebrated. I want him to feel wonderful as much of his life as he possibly can. So when we have this approach, we can find some peace. We don't ever really stop worrying. That's outside of the definition of a parent. If you are a parent, you are worrying. But if you are a special parent, we have special concerns, and there's another level to that worry. There is more peace available to us, though, when we stop living exclusively in the present. And I understand that I wake up, my son needs this support. We have the timeline. This is when he has his meds. This is when he gets off the bus. This is when we have supper. This is when, thank God, I get to start the bedtime routine. We have a lot in our day-to-day activities, but if I only focus on what's happening today, I'm going to look up and it's 5 years later and we are no closer to having a plan for that future. So I have to be able to stop thinking exclusively about what's happening today and start thinking about what I want to have happen in the future. Once I start to share those tips and tools and techniques, that's going to help me not feel as isolated. And it's also going to empower others in our lives to start providing some support. So I don't have to be the only one who knows the information. I don't have to be the only one who can navigate that medical appointment. I don't have to be the only one who knows how to take a deep breath. Let's do another one more to calm my son down when he's upset. And we also really have to stop the knee-jerk resistance to any kind of change. And I'm guilty of this. When things are kind of in a good place and there are no problems and things are going okay, and we have a teacher that we like, and the driver understands and doesn't honk and wake the neighbors up, and things are kind of okay, I have fallen into that, don't rock the boat. Don't start asking questions. Don't make any changes. Things are good right now. Let's keep it right here. But the only constant in life is change. It's never going to stay exactly the way it is right now. So I have to start thinking about this new step. And it can be a small one. It doesn't have to be huge. I don't have to solve it all in a day, but it is also always possible to take one small step in a new direction. It is not something that's going to stop. It's a never ending process. Even once we have a plan, even once we've identified those highlights, even when we have a team assembled and there's a clear vision for the future, we have that letter of intent, there's really no true end to the planning process. Because again, the only constant in life is change. So supports, services, laws, and expectations for people with disabilities continue to evolve. And we see that all the time. There are services that didn't exist 10 years ago. There are services that we counted on that no longer exist now. And we are going to continue to see this evolution. So we have to be ready to continually evolve our plan and our communication and our highlights and our non-negotiables to accommodate those changes that are happening in all of those other services. And our children will continue to learn, grow, and change. Our kids are lifelong learners. I had a wonderful example of this just a few weeks ago. My son had a very challenging dynamic with a peer who messed with his stuff. And my son guards his stuff. He did not want anybody to touch his stuff. And we have been talking probably since he was 2 about not taking other people's things. You wouldn't like it if other people touched your stuff. Don't touch other people's stuff. And, it's okay to be upset. It's not okay to hurt people. We've had all of these conversations. This individual messed with my son's stuff and he went over and said, "That's mine. Leave it alone." He didn't make any contact. He didn't do anything other than identify this was his, and he asked the person to leave it alone. And then he used language that he had heard, and over time he's like, "Calm down, calm hands." And then he let staff kind of intervene. And once things were kind of back where they belonged, he identified, "I don't want to sit next to him." And he moved a chair over so he could have some distance because he was upset that person had messed with his stuff. And about an hour later, when he had calmed down, spontaneously, he walked up to that person. He said, "I forgive you." Heart melting. If you had asked me even 2 years ago, would my son ever appropriately handle somebody else's actions with appropriate language without getting physical and then respond to his emotions in an appropriate way and express them verbally? I would have said, "Who are you talking about? That's not my son." But all of the information, all of the teaching, all of the practice is starting to blossom. And our children are lifelong learners. Just because they didn't do it at 5 or 15 or 25 doesn't mean that it might not bloom at the age of 40. God willing, we'll be there to see it and celebrate it, but they continue to learn and grow as well. So our plan has to have the room and the breadth for that to happen. So it's ongoing review and updates are necessary, absolutely, to keep information current and relevant. So when and if that moment comes where the plan has to be implemented because I'm not here anymore, it is accurate information up to the minute of my passing that is going to help anybody else make sure that my son has the quality of life that I dream of for him. So I think of it as a roadmap. Life planning is a roadmap. We know where we are. We can see on the map, this is where we are right now. And I see where we're trying to get. That's the optimal future. And that exceptional quality of life, it's a destination. That destination might change. We might still be going east, but we're not going to that specific location on the map, but we're heading in that direction because we might have come across a detour or a road was closed, or hey, there's this new superhighway that just got put in and it's a lot faster. We have a map, we know where we're trying to go, and we also have the ability to change that destination when it's necessary. But focusing on where we are and where we're trying to get helps us see the steps that are necessary to move in that direction. And knowing that we have choice, that we have some action that we can take, that we're doing it with intent, that's what helps us find peace in the present. So thank you so much. I'm Wendy Smith. I'm the life planning specialist for Home of Guiding Hands. And that's a picture of me with my son. And I will go ahead and share the mic to Shirley.
Thank you so much, Wendy. That was terrific. So, this isn't just about thinking about it. This isn't just about worrying about it, but it's really starting to put some action into our worries and taking that energy, if you will, and figuring this out. So I'm really pleased now that we have two individuals from the San Diego Regional Center, James Perez and Delia Yepes, and they are going to talk to you about a service that is fairly new, coordinated family supports, which are available through Regional Center. So I'm going to turn it over to our speakers. Thank you.
I wanted to be Britney Spears, but I'll use this.
I think so.
Thank you. And just to get a gauge, show of hands, is everyone familiar with Regional Center? Is there anyone that is not or fairly new to Regional Center? Okay, good. So we have our audience. And we are here to talk about one of fairly new within the last few years, a new service here at Regional Center. But first, James will talk a little bit about traditional because we're going to explain how and why we have coordinated family services.
Yeah, so can you guys hear me? Yeah. So coordinated family support is a service that is meant or is geared towards our adult clients. We have other, I'm going to give a broad introduction to some other traditional service that we have for our adult clients. We have respite, which is intended to provide, a break in care for our parents, for the individuals that we serve to provide a break in care. We have our day programs. So typically, after they exit transition program from the school district, they have the option of going to day programs. And day programs are geared towards, focusing on vocational, educational, or community integration goals. And then we also have our independent living services or supported living services. And those services are geared toward helping the client, be independent as possible. So they to help with like helping them with scheduling their own doctor's appointments, helping them with learning things in the home to be independent, like cooking, meal planning, budgeting, things like that, things that are geared towards being independent. And supported living services also is whenever they are living by themselves, they have support as much as they need in the home. And we also have employment services. So a lot of the times we connect with DOR and we are able to provide like job coaching and job development. And we also have our a service that is fairly new, which is the social recreational activities, which is focused on helping a client identify what they like to do, and we are able to fund for those activities that are out in the community, like gym memberships, YMCA memberships. I was just talking to somebody in this table. They're saying that their child's receiving horse therapy sessions. So anything like that that is the client likes to do, we are able to fund for those things. So we recognize that even though we have all these services available to our clients, there can be barriers, right? There can be barriers for them to receive these services. So I think this is kind of what Coordinated Family Supports came about, and this is we're going to talk a little bit about how we can support in minimizing these barriers and kind of how we can support the clients and their families with these.
Yeah, and so it was, realized that obviously we want to be there to support individuals that we serve and, our loved ones to be able to live independently. But with that, there sometimes is a choice and there is the option to live in the family. And what about the family as a whole? There's never really been a service that's geared toward helping the family and the parents, caregivers, and loved ones. And so coordinated family services, that is our criteria and that is the focus, right? And this is what we'll cover. We wanted to dive deep and give you all a little bit of examples and supports and information that our providers are working on right now. But to give you an overview, this is, the service description, right? It's just tailored to meet unique individuals and the family. Again, and it provided in a manner that respects language, culture, and it is in the person's home and community. And I won't read to you, but generally here, the criteria is that the individual is 18 years or older, and they're choosing to live with their family or caregiver, right? Whatever that looks like. And it was just created because there was really that lack of resources, as I mentioned. And it goes into detail. There's an assessment that gets completed. Once you know that this is maybe a service you want to explore, you just reach out to the service coordinator and ask for more information on coordinated family services. And almost immediately, one provider will come out to the home and complete an assessment. And what that looks like is there's 10 different questions and areas. And we wanted to go over that in detail so that you're aware of those questions that are asked. And I know it's a little wordy, so we apologize, but like I said, we wanted to provide as much examples. And these are actual examples that our providers have sent to us. And so the first question is identifying and providing supports that are necessary, right, to reside in the family home. So what does that look like? And what is the provider going to do to assist with that? And so connecting with resources, maybe classes, allowing that development of socialization skills. Maybe they want to create a safety plan. Unfortunately, the fires that happened in North County, there were many of our individuals and loved ones that were affected at that regional center. And so now taking into action that safety plan and assessing that and creating that plan with the family, whether it's in the home or outside in the community, maybe researching local supports and agencies. So these individuals are really in the home, and there's really, depending on the need, that's the qualification here as far as hours offered monthly. Perhaps it's respite, overnight supports, and ensuring that family has reliable, assistance when needed. And if you notice, there's an asterisk by number 1, because with this support, the service does allow for direct supports on a 3-month basis. So as an example, if there's a challenge with finding a respite provider and that agency also provides respite, but maybe they're a little bit out of the area, they will come in and help for those 3 months until they locate something that works a little bit better for the family or a service provider that you choose. And so that's what, if you look at the questions when you're looking at this assessment, that asterisk just means that they will provide that 3-month direct support. And so this is where, as Wendy was mentioning, just having that information, providing that information, you can have this, reassess it, revisit it, right? It doesn't necessarily mean that you have to provide everything right then and there, but what is really important to have that provider get started on. With this service, there is a requirement to have a reassessment or a review every 6 months to see if it's still appropriate, if hours maybe need to be adjusted, if there's a change in the need with these services. And then the second one is providing assistance and training for our individuals and navigating services and supports that are tailored to meet unique needs, creating pathways to overcome barriers to accessing generic and other resources. We see this a lot, especially with our monolingual or bilingual families, where there are challenges in accessing SSI, perhaps CalFresh, Medi-Cal, any applications. So here is where we can really have that information entered there, and they help support with completing documentation, with continuing, if there's a challenge, to make sure that there's follow through and, do that closed loop referral. And there's many others that go there, but I think the basic one is that, providing training and assistance, or if there's others in the family, maybe there's a challenge there with understanding the complex needs or, the different services that are being offered. We can also create a plan to maybe help those individuals or loved ones that are living in the home that want to know a little bit more and be empowered to learn a little bit more. They create a plan to provide that information. And then the third question, and not all these questions need to be answered. You can really just talk about where the need is, and that's what they will focus on. So the third question is providing additional information or resources on individuals' diagnosis and identified supports. We've seen this a lot when there are multiple families living in a home. And like I said, perhaps they want to have a bigger understanding, a greater understanding, and empower themselves to learn more about diagnosis and services. And so that's where the coordinated family supports providers will help create a plan and help them understand that. And so if you see here, this comes from our providers and what they're writing in those recommendations and assessments on the information that they'll provide. So they're going to connect the provider or individuals and family to Autism Society of San Diego to find additional resources. Maybe there's groups in the area that they're going to help them look into a little bit more and support that family's understanding, or maybe detailed diagnosis, right? Just how it impacts, just different approaches that they have, and that way that everyone supporting our loved ones in the home have that understanding. And then the fourth question, coordinating consistency and training across providers specific to needs and individual of the family. And so with scheduling appointments, perhaps, on their own, with or without parents' help, or let's just say they want to continue and work with mom or work with loved one and caregiver to do those calls together. Maybe they want to be independent. So it's case by case basis, really. And that's where, you have that empowerment to really communicate here. What is the need of the family and what would you like a CFS to help with?
So something else that CFS is able to assist with is able to help the family or the individual with scheduling, service delivery, including like medical and other appointments. So I understand that at times, families have a hard time with like being able to schedule doctor's appointments or medical appointments. So they're able to help and assist with that as well. The other area is identifying transportation options of services. So I'm a program manager over in our Eastlake office, and we serve a lot of the remote areas like Ramona, Descanso, Jamul. So this is one that I typically, we run into a barrier. It's that not being able to find transportation to our clients and families. So CFS providers can go in there and try to find transportation for our clients to day programs or to employment or to school or whatever they want to do. So this is something that they're able to support with. Um, Also, they're able to identify backup provider supports and providing those. Kind of what they were talking about earlier. Like they're able to identify who's going to take care of this person whenever we're not available. So they're able to either come up with a plan B or a plan C, just in case that time comes. The other area where they're able to help is providing future planning for the consumer, including those living with aging caregivers. So it's very similar to that. They're able to kind of identify what is going to happen after parents are not going to be there. And the last thing is providing training to the individual, which maximizes their independence. So this is very similar to our independent living services service that we have, where they're able to train and provide training to the individual and like helping them how to be independent and just teaching them different things, different skills to be able to be independent.
And we have seen that a lot of our providers that also provide independent living, supported living, are now offering coordinated family services. And for that continuity of care, we're seeing that some are, working on this and then transitioning and easing into independent living. Because they're already getting that information through CFS. And we have currently over 15 providers with these resources, but we're really trying to get the word out there because I think this one is important. And whether you use it for a limited time or it's something that needs to continue working on different areas as they come up, definitely just our really big push is to talk to your service coordinator more about this service. And this is our referral process, so you're aware. So there's that initial meeting. Those same questions that we went over, those are provided by Department of Developmental Services for all regional centers across the state. But that's the one assessment that we use. And it begins by that initial meeting. I have these concerns. Let's go over which questions are applicable. And then the team will then find, or you decide who the provider of your choice will be. They come out, do that assessment. Once they do that assessment, they submit, the recommended hours, however many hours that would be, and there it is reviewed. And then from there, they get started after we add it to our amendment and we get that signature page. And then, after 30 days, we have a check-in. How's the service going? Is everything working appropriately? Are there any concerns? And that needs to be reviewed every 6 months. Yeah, it's been exciting to know that it's a service, they're out here to support our families as a whole. And we just have, for information, if you guys want to take a note and look at what that assessment tool looks like, if you look at what quarterly progress tool, from DDS, those are the verbiage. If you have access to the PowerPoints, the links are there, but that's all you have to look at is the enclosure D and enclosure C for those forms. That was just on service, but go ahead.
So when you're talking about the service, these hours are in addition to whatever hours the client's already received?
Yes, they are in addition to the any services that are being received at the moment. And if you have self-determination program, it is separate from the self-determination budget.
Because
Yeah. Sure.
I hate to bring up a terrible topic, but have you heard yet, are there going to be funding cuts to the regional center?
We haven't, and that is something on our mind, and that's why we're, hoping that more families are accessing this very important service, because as of right now, no, we've been told that it's now no longer a pilot, because that was the word that was being thrown around, that we were having this as a pilot.
Okay.
But to our knowledge, we're hoping that this is one that's permanent and stays, because I know there were, concerns.
Yeah, very much.
Yeah.
Thanks.
Thank you.
If you have a question, just go ahead and raise your hand. We have someone with a microphone around the back. I'm going to have you bring to her so I can have this pass. Your questions can be for any of the panelists as well. Okay, thank you.
I just wanted to know, I love a lot of people and have a lot of loved ones who I feel are in the situation that you guys are talking about, where they're scared what'll happen. I want to know, how do you what process has to happen for you to work in the service that you're talking about? Like,
You mean as an individual that receives the service?
as someone who had worked there, like in your position. Yes.
They can talk to you about, you're asking about, everything, right?
Yeah.
I think that would be good if you just, chat with them afterwards. Sure. Thank you.
I wanted to talk about the housing situation. I mean, I'm very fortunate. My son lives supported by Regional Center in his own apartment. He's profoundly autistic, but he has 24/7 care. Sometimes that's me, but I can't tell you when I take him back and forth between my house and his apartment, like he just wants to be independent in his apartment with support, and it's a beautiful thing, and I'm grateful for that. One of the things I worry about when I'm gone, I'm an only child, he's an only child, so there is truly no one when I'm gone. Does that service, what I'm trying to find is I've got a trust, I've got a lawyer, I've got a financial advisor, but I don't have anyone who is me and knows how to navigate the 5 systems I navigate for him. Is that a fiduciary? Is there a job that somebody does that is like that you know of?
Yeah, maybe it's something that your agency does. I don't know. But for example, there's an outfit, I mentioned it, called National Care Advisors. So these are private companies. That one is a for-profit company. Another example I mentioned was Good Shepherd Fund. That's based in the Bay Area where I live. That's a nonprofit model. So you can find some of these around, and they provide what are essentially called case management service. So if you have a special needs trust, for example, that trust can pay that case manager, and they usually charge by the hour for whatever work has to be done, right? And the work has to be done at every single level, from the highest level, which is like managing the systems, right, down to who is, helping him with a bathroom, right, and everything in between. But they hire people to do those jobs. Now, if you have an SLS program, obviously most of your day-to-day concerns are taken care of, but the bigger picture seems to be what you're worried about. And they both of those agencies, for example, can do that. I don't know if we should put together a list of all of those agencies that do them. I don't know if they're, maybe a fiduciary organization might have a centralized list. I'm not sure. It's a great question. But yeah, I mean, literally, like theoretically, the regional center, that's kind of their job. But in reality, the service coordinators are not doing that. So this is one model that can help, but this model wouldn't apply to somebody in SLS because that person's not living in the family home. Ta-da.
I just want to add on, if you are a conservator, then you obviously also have that kind of, there's nobody to step in as a future conservator. There is a public conservator role that they would, in lack of anybody else or any other agency, it would be their responsibility to have that oversight and give that high view to ensure quality of life. Not the public conservator. You're thinking about a public or fiduciary. So they're different roles, but public guardian, yeah. I know they're guardians in other states, but they're conservators in California, I think. But
Yeah, that's true. I should have mentioned the public guardian. Public guardians can play a quality of life role. They're not like fiduciaries in a trustee sense. So definitely look into that. I don't know many details about it, but I've had to deal with public guardians with some of my tenants who are developmentally disabled, and they do advocate for them.
Question for the presenters from Regional Center regarding number 8, where they said that this family coordinated family services can provide future planning for consumers, including those with aging parents. Is it possible that clients can use funds to hire someone like Wendy to help with the workshop to make the plans?
Well, it's the providers are kind of exploring those options. I don't think they necessarily will provide the service, but they'll provide the option and create that plan or create the resources of your choice that will create that plan. And actually, I mean, DDS wrote that, but I still don't like the word consumer, that it's still up there.
There, I have a quick question. I just want to go a step further. What happens if the parents of the child already pass away, and then when it's time to the child with disabilities to die? How is the preparations for that point, and how we can address before that we pass away as a parents?
That's something that's a conversation to have with that provider, that is the concern, because, you know, unfortunately, it's not something we always want to discuss, but to have as much planning as possible. So this service, though, specifically the service to qualify, the individual has to live, you know, in caregivers. It doesn't necessarily have to be parents. It's just caregivers, whoever, you know, living not independently. But that, like, it's so individualized that it would just be a question that you talk with the provider and create out a plan for that. Yeah.
So just to clarify, I think there might be, I have a question in my mind. So to be eligible for CFS, what are the criteria? Because I'm hearing they have to live in the family home, but now I'm hearing they can be in a home with non-parent caregivers. If it's their home, is that correct? No. Okay, clarify that, because I don't know if the rest of you are confused a little bit, but I want to make sure we understand who's eligible for CFS.
So to be eligible for CFS, they have to be 18 years or older and living in under a family home or caregiver, you know, supervision. So
Pretty much not independent.
not independently.
That's the piece I'm not understanding. As you're saying, living in the family home, because when I talk about children are going to get my house, so they're going to be in their own home.
Okay.
They're gonna be eligible for CFS.
So then we'd look more into independent living services.
That's where it's a little messy for me.
I guess under the supervision of either parents or
Right.
caregivers. Yeah.
You're in a granny flat on your parents' property, that would be IL.
Use the mic.
Okay, thank you. Okay, any other, thank you, questions so we can hear? Thank you.
Hi, what is the qualification or who would I expect to show up at my house if I try to get CFS, which I think.
Memorized, but on our website, on DDS website, they have that information on there. Our providers are required that kind of have, you know, certain information. Our community services is also our department that you would contact to get that specific detailed information, because it does have kind of set criteria to be a provider, and they have to go through, you know, process to qualify.
Do I understand correctly that in the same way that a family can choose who their ILS provider is
Yes.
going to be, they can also choose who their CFS provider is going to be? So from the list of eligible agencies in your area, you have the choice who is going to come into your home, so you get a chance to decide.
They have list kind of area served, languages, if there's different languages spoken in the home, for that match as well.
Any other questions for our lovely panel?
This, if I clarify, this overlaps with self-determination?
In addition to self-determination.
Outside of the budget. So if you have self-determination, you can ask or request, talk about coordinated family supports if appropriate, and it comes out of regional center funded services, not the budget.
So, and it's in addition to.
Yes.
Right, yes.
Me again. Could home guiding hands be covered under self-determination? I know that there's some trainings that you do that would be, but this life planning, would that be covered under self-determination if we were to hire you?
Yes.
Oh.
Well, Home and Guiding Hands is not a CFS provider.
Right.
But
But for consulting.
I do the life planning workshop series, and families
That's
can
right.
use self-determination funding to pay for that.
Okay, that's right. Okay, I forget. That's what my IF said now. I remember. Thank you.
Can you repeat that?
Sit over there.
Can you just repeat?
Wendy, is it also a traditional service though?
Yes.
Yes, there's also a traditional service code. It's 102.
Yeah, that's
It's considered,
I'm sorry, I
training,
was
so
just,
if you were funded by Regional Center for this training today, you would not be eligible in this fiscal year. You would have to wait to the new fiscal year in July. And then you would be eligible to select it as your parent training for the year. Fortunately, July's dates are available on my website.
Did you write them down?
Looks like we have some online questions coming.
Okay, we have virtual attendees today. The question was, my son only trusts myself and my daughter, meaning I think this is the parent. So myself and my daughter, his sibling, who already provides respite and IHSS, could I or she be the CFS support? So this is a parent saying, can myself or his sister be the CFS paid support?
The only way is they become a provider. Yeah, because
So they'd have to become a professional provider. They'd have to be designated as a CFS and vendored with either the regional or through self-determination. So the answer is theoretically yes, but they'd have to go through a process of becoming a provider. Okay, thank you.